It's Raila Odinga's farm. It can be issued with a contract. All they want is ballot papers to enable the country have an election in August. Sophia.
All right, many thanks, Rita Tinina, for us there from our city center studios on that controversy over the printing of ballot papers. And we will bring you details from that meeting later on today between IEBC and presidential candidates. Now, postpartum hemorrhage is one of the most common cause of maternal mortality. There are several ways to manage it, among them ensuring availability of blood in hospitals to transfuse to mothers who have lost a lot of blood during delivery. As the world celebrates World Blood Donor Day on Wednesday the 14th, it's important to look at issues of blood availability. And that, of course, was yesterday. And this goes a long way in saving many women who suffer postpartum hemorrhage.
Immediately venye nilijua niko mjamzito, nikaenda kliniki. Nilienda kliniki for 4 times. Sasa venye wakati ilifika ya kujifungua, nilikuwa najisikia kama tumbo inauma, inaachilia. Inauma, inaachilia. Sasa venye nilikuwa katika hiyo hali, nikapigia wa pikipiki na hakusita. Alikuja immediately, akanichukua, akanipeleka Webuye Health Center. Muda venye ilifika, nikajifungua tu vizuri, shida ikakuja kwa placenta. Placenta badala kutoka yote, ikakatikia ndani. Hali yangu ilikuwa mahututi, ilikuwa na bleed tu sana. Ambulance ikakuja ikanichukua, ikanipeleka Lugulu, nikiwa hali mahututi sana. Sikutarajia kupona maisha yangu.
When I went there, she was not in the normal maternity ward. She was in a separate room. I think where they do first aid, when they carry out first aid or something like an emergency case. Later on, they came with a form. They told me to fill the form because they told me that your wife is going for an operation.
Nilianza tu kuomba Mungu, nikasema Mungu wangu, hawa watoto wawili nikiwaacha watakuwa aje kweli?
When we look at the issues of postpartum hemorrhage, we are looking at 4 causes. The first cause being uterine atony. The uterine wall is unable to contract adequately to achieve hemostasis. And it is the key killer of mothers who come in with postpartum hemorrhage. So the second cause is what is known as the tissues. What happens is that sometimes after delivery, pieces of placenta or membranes may be retained within the uterine cavity, and this one could cause serious bleeding. The third cause of postpartum hemorrhage is trauma, and this basically is injury to the genital tract following delivery. We have the fourth cause, which is thrombin. In thrombin, we have a defect in the blood clotting mechanism.
If you were to put 2,500 women physically in front of you, that's like more than 150 matatus, yeah? That's a lot of women. So what would we do in Kenya if 150 matatus full of women were to die in the course of 1 year? You know, there would be an outcry. We would all take action. And so that's what we're doing. We're taking action to support Bungoma County specifically with a cause of death that really can be prevented.
So if this other, like the oxytocin has failed to work, now especially with the atonic uterus, if oxytocin don't work, we go to the bimanual compression. If it doesn't work, we go to the misoprostol. If it doesn't work, then now we can go for the UBT.
The uterine balloon tamponade basically works in two ways. The first mechanism of action is that with the condom in situ filled with water, what happens is that it applies pressure on the uterine wall. And when that pressure is applied on the uterine wall, including the open blood vessels, especially at the placental bed, that pressure closes up the open blood vessels, and we are able to achieve hemostasis, or we are able to stop bleeding. That is one. The second way in which it works is that when it is in situ, the uterus depicts it as a foreign body. And normally, when it depicts that there's a foreign body in it, it contracts in an attempt to expel it. So as it contracts, that contraction helps it in closing up the open blood vessels. And that way we are able to achieve a hemostasis, or we are able to arrest bleeding. At times, we have clients delivering at home, and they reach the facility when they have lost so much blood, such that even if you intervened with the uterine balloon tamponade, what you'll achieve at that point in time is that you'll just stop the bleeding, but you may not be able to recover the blood that the client has lost. So if the mother has lost so much, then we actually need to transfuse.
Sasa daktari venye aliniangalia hivi, akaniweka damu paindi moja kwanza. Venye akanipeleka theater. Venye nilitoka theater, tena akaona kweli sina nguvu, sina damu, akaniongeza paindi ingine. Sasa hizo ni paindi mbili.
This kind of challenge occurs immediately a mother delivers. So it's like you are not expecting that this mother is going to complicate and have PPH immediately. So the blood has to be standby, because it's something which it's an occurrence that is sudden. So if you don't have blood, you are likely to lose that mother.
A mother was taken for cesarean section, emergency cesarean section. Then she developed postpartum hemorrhage in the process. So we ran to the laboratory, there was no blood. We rang the institutions around here, there was no blood, and that's Lugulu. So we had to ring to the satellite, which is in Bungoma. Now, Bungoma is about 30 minutes away. So they said they had one unit. So we sent our ambulance to go bring that unit. So by the time he was arriving here, the patient was gasping. We put up the blood, it didn't go for 30 minutes, the patient died. It was a very painful experience. To me, I was frustrated because I had made all the ends meet, but only now blood component made me lose the mother. So I wrote a case study on the what was prevailing, what happened this time, what was done and all that, until the time the mother died. So I presented to the money.
When we got that request, the first thing we did is to work with the Bungoma satellite and see what are some of the areas that they would like us to support. So one thing that we support the satellite is to do bi-monthly blood drives. We also supported them to improve their cold chain. We bought them a blood bank fridge, which they had issues. They had a very small capacity. The blood bank fridge they had was a 54-pint capacity. And sometimes they would go out and collect more than that.
The MANI project stands for Maternal and Newborn Improvement, and we're funded by the UK Department for International Development. We try to improve the supply and the quality of high-quality health services, but also the demand for those health services. So working with communities, working with health workers, working with managers at all levels of the health system to collectively improve the strength of the health system to deliver services. And we've seen blood availability as a big problem in Bungoma and in Kenya. So we've tried to adapt our program a bit to be more responsive to this specific issue.
According to WHO standards, 2% of the entire population are supposed to donate blood to feed the sick population. But in our population, you may find, like in our communities here, we are under that 2%.
We just want to up our campaign strategy in blood donation. We have been serving as a blood transfusion satellite center. But now we are increasing that status to a regional blood transfusion center. When we do that, even the framework of managing that service will have to be upgraded to that level. And I believe the campaign and the response to the blood transfusion donation and preparedness will be taken to that level, commensurate with the center that we have established.
We also need a much higher commitment to funding blood accessibility in the country. The National Blood Transfusion Service estimates that every pint of blood costs 10,000 shillings to produce, from front to back, from all the outreach that has to be done to screening, transfusion. So if we're only about halfway there, we need a really significant increase in funding, particularly from the government of Kenya, to allocate more resources to blood availability.
Damu haiwezi kununuliwa, wala damu haiuzwi madukani. Damu tu itapatikana kwa wewe ambaye utajitolea kuweza kutoa damu hapa.
Our people must understand, there's no way you will just walk in an hospital, donate blood, and it's given to your person. No. Blood must undergo a process. Screening is a process. You must be given somebody else's blood, somebody who donated that blood somewhere at a time. Donate blood, then it's kept, and then it is given somebody else. By the time you replace that blood, it will be given somebody else again to come.
Hatukuitishwa damu. Hata mimi nilitarajia labda wanaweza sema uko na mtu mwenye anaweza toa damu, lakini si kuona. Wenyewe walikuwa tu na damu hapo ndani. Hiyo damu kama haingekuwa ningekufa. Saa hii hata mtu akiniambia toa damu, kweli I'm able kutoa damu juu nilipata huko, ikanisaidia, ikasave my life.
For Kenya, we want to see all mothers having healthy childbirths and surviving, and we want to see all those newborns surviving. Yeah? We want to see a really dramatic reduction in the rate of maternal mortality and the rate of newborn mortality. And it's possible. Most of the deaths, like I say, are preventable. So with a stronger health system, better trained health workers, faster care that's of high quality, that vision can be a reality.
We want to make sure the services for maternal health management at the referral hospital are competently delivered. These services are delivered by having the commensurate personnel, and these include the specialist doctors in the area of maternal health. All this is meant to make sure we don't risk a mother in pregnancy.
Nikipepa mtoto wangu najisikianga yani mzuri sana. Sikutarajia kama naweza kuwa alive na nipepe mtoto wangu hivi. Sikutarajia.
I want to tell people outside there that donating blood is saving life. You are saving your own life, not even the life of others, because it reaches a time in life where you will also need somebody to donate blood for you. My family is a beneficiary of that. I can attest, I can give an evidence here that we've survived because of that. At least my elder daughter has a mother. At least this newborn baby has also a mother, and I have a wife.